Welcome back to River City Live. It's time for Care for Kids, where we team up with Wolfson Children's Hospital and their medical experts to bring you tangible and helpful tips to improve the lives of your children. Today, we're talking tips to protect your child's mental health with psychologist Leanne Anati. So thank you for hanging out with us today.
For having me.
So you and I were just talking about infant mental health, and I'm like, I'm so confused. And you were breaking it down for me, and so you're like, it's confusing to a lot of people. So could you give it to me in layman's terms?
Yeah, infant mental health tends to be puzzling because we associate infancy with hope and innocence, and usually mental health is associated with maladjustment and stigma. So putting those two concepts together can be puzzling for a lot of people.
Oh yeah, especially when you're a new parent. If you maybe you've had a kid and you're like, oh, I got this, but you got a new kid and you're like, wait, what? So what is infant mental health, and when can parents start supporting their children's mental health?
Basically, infant mental health is a multidisciplinary profession that focuses on the practice and policy of social emotional competence and child development between birth to 5 years of age. So when can parents start? It's when they're pregnant. And so we're really going to focus and prioritize on the mother's physical health, but also her mental health. So with physical health, we want to focus on prenatal care, avoiding drugs, alcohol, and smoking, taking your prenatal vitamins, checking your medications with your doctor. When it comes to mental health, we want to reduce stress levels. We want to work on coping strategies. We want to have a really good diet and sleep-wake schedule.
Good luck with that. So, well, what are some strategies during early childhood to support your child's mental health?
One of the most research-based strategies is having an enriched environment, which means having an environment that fosters safety, security, but also curiosity. So we want age-appropriate toys, we want arts and crafts, we want to play with our hands and be outside, and we want to have that secure attachment with our parents where we feel safe to walk away and come back. So parents also want to model self-regulation. Parents can start modeling that within their child's first year of life, how to calm down, how to co-regulate when you snuggle your baby and you take deep breaths. And then you want to talk about and label and validate emotions.
That's some really deep thought to process. I'm like, yeah, I missed out on all of those. And just really quick, what should parents look out for or monitor for in infant mental health?
So the first ones are the risk factors, where doctors are typically already monitoring you. If a child's born premature, exposed to any toxins, drugs, or alcohol, any malnutrition. And then we also want to look at any kind of early life stress. The brain starts forming really early, so early life stress can affect the cortical thickness. It can affect the development of the hippocampus and the frontal limbic system, which means it does have long-term impacts on the child's ability for learning and achievement, for coping and managing with stress, and developing trusting, stable relationships in adulthood.
Yeah, we're still working on that in adulthood, but that's some very good, insightful information. So if you want to find out more about these programs at Wolfson and maybe connect with Dr. Leanne and her team, you can visit wolfsonchildrens.com/services/behavioral health. So thank you for that information. That's going to go a long way to helping some parents in the future for sure.
Thanks for having me.
When we come back, we have more River City Live coming your way. Get ready to save and shop with Insider Deals.